Hi everyone, my name is Maria Bison. I'm going to present my analysis on the performance of George Washington University Hospital Quality Measure Report. This is in the fulfillment of the case study project for Statistical Process Improvement HOP 725 at George Mason University, narrated for Dr. Farouk Alimi. I will be analyzing the George Washington University Hospital's performance using the control charts. I use the quality measures based from the AHRQ 6 domain of healthcare quality, which are the safety, effectiveness, patient-centered, timely, and efficient. I selected this major organization based on the size of the hospital, similar services, and location, which means that these organizations serve a large population in the DC, Maryland, and Virginia areas. The data came from the data Medicare.gov Hospital Compare. The limitations are that there were some missing data, some quality measures were discontinued, and the abstraction takes time and use a lot of memory, and the data is huge. The first measure is the median time from the time the patient arrives in the emergency room until the patient is being admitted in the hospital. In other words, how long the patient is waiting in the emergency room before the staff admitted the patient as inpatient. There were 7 data points. There were 2 time periods where the hospital was above the control chart, which means that there were time periods when patients are waiting in the emergency room compared to the other major hospitals. I used a 2-key method to calculate the upper control limit and the lower control limit. In this chart, we are looking at the mortality rate for patients who were admitted with COPD. Here, George Washington University's data is within the control limit, meaning that their mortality rate for patients with COPD is not much different from the other major hospitals in the area. Here, I wanted to see the hospital's sepsis rate after surgery. The data indicated that the George Washington University's post-op sepsis rate is within the control limit, meaning that their performance is about the same as the other major hospitals in the area. There were time periods that their sepsis rate is below the control chart, which is not a bad thing because that's actually lower than what we want to. In this chart, I wanted to look at their efficiency in using the diagnostic imaging, such as the MRI for lumbar spine for low back pain. This measure was created by CMS to check for the appropriateness and effective use of imaging in a clinical setting. Medicare spends approximately $14 billion annually on outpatient imaging studies. So in this data, George Washington University efficiency score is within the control limit and about the same as the other major hospitals in the area. For this chart, I wanted to look at the reimbursement rate for certain procedure based on the value of care. For the hip and knee replacement, George Washington University reimbursement rate dropped during the time period between 4/12/2015 to March 31, 2018 it dropped to approximately $21,000. In conclusion, George Washington University's reimbursement rate for hip and knee replacement has decreased in recent years, and their ER waiting time has increased higher than other major hospitals in the area. The hospital may need to look at staffing issues and look at the root cause analysis why their reimbursement rate has dropped, considering that it is based in a major city. And that concludes my presentation, and thank you for listening.